Hi, everyone. Welcome to our Guess Who panel hosted by Health Professions Week. My name is Mandy Now, and I'm the Executive Director of Health Professions Week. I'd like to start by saying thank you to each of our panelists today, each of whom you will have a chance to meet after they've done their very best to stump you today. Here's how the Guess Who game is going to work. I'm going to have each of our panelists introduce themselves to you. Each will have 1 minute to describe what they do on a daily basis without revealing their profession to you. Take good notes and make your predictions on what each profession each panelist represents. When we're finished, I'll have them reveal to you who they really are. I'll even start with a hint. Here's a list of the professions represented on our panel today. Can you guess who? Now, what we're going to do is let's start with Matt today.
All right. Hello, everybody. I hear that you'd like to know a little bit about my profession. Listen closely as I make to you my confession. I wear a stethoscope, scrubs, and often gloves. My patients are ages birth and above. People think my degree is from Gray's Anatomy, but I tell them I'm from a different type of university. Electric-powered instruments I usually suggest to help people improve speech clarity. Who am I?
Excellent clue, Matt. All right, Pooja, I'm going to have you go next. Can you stump our audience?
Of course I can. So guess who I am? I'll give you a couple of questions. WH specifically. Who? Well, I work with from birth to geriatric, kids, students, and adults. And what and where? I service all types of settings, anywhere from the medical to educational, and even including judicial. How long? It takes about 2 to 3 years to complete my degree. Guess who I am?
Wonderful clues again. Danae, I'm going to have you introduce yourself. Can you stump us today?
I'm going to try. Hi, my name is Danae Lowell. I grew up wanting to be a doctor, but I never knew my chosen specialty even existed until I was pre-med. Income, lifestyle, daily challenges, and endless personal satisfaction make my chosen profession a perfect match for me. I went to graduate and postgraduate college for a total of 8 years to attain my degree. Every year I became a little more specialized in my field. This culminated in 3 years of medical and surgical training at the VA in Cleveland. I spend a lot of time in the operating room, the outpatient clinic, on the hospital ward, and doing research on the side. I love my job and what I get to do every day, which is taking care of veterans. Of all the surgical specialties I could have chosen in the OR, I'm always at the far end of the bed from the others, literally opposite the anesthesiologist.
Perfect clues. Okay, Talia, your turn. Can you stump us?
I will try, but I admit that my colleagues are very impressive. So I will do my best. I spent a lot of years in school, so it took me 8 years after college to get my training, which feels like a perpetual journey. All of the time, I am asking questions either of patients or in different settings in the laboratory where we're trying to understand why people have certain problems that they do. Many of them are fevers and chills, and sometimes other interesting mysteries that arise from where people have traveled to faraway places. But we don't stop at just figuring out the diagnosis. We're also interested in understanding why it's happening and being able to figure out new ways to treat those problems.
Great clues. Okay, Gretchen, your turn. Can you stump us?
I will certainly try. So I'm involved in direct patient care, taking care of people before they're born through the end of their life. We advise other healthcare practitioners on evidence-based guidelines for treatment. We focus on preventative care and also treatment for conditions. Most of us spend more time in front of the computer than any other healthcare practitioners. We solve problems and can even make products to meet our patient needs. We are the final therapeutic check before a patient starts their therapy. It takes a minimum of 6 years to get into my profession. Can you guess who I am?
Excellent clues. Okay, I think you guys have really stumped them. So now let's get ready for our big reveal. Matt, I'm going to have you reveal to us who you are.
Drum roll. I am an audiologist. Woo!
Those were some great clues. All right, Pooja, can you reveal to us who you are?
Of course I can. I am a speech language pathologist, also known as SLP.
Excellent. All right, Danae, who are you?
I wish I had Matt's drum roll. I'm Dr. Lowell, and I'm a podiatric surgeon. I specialize in the foot and ankle, but as you can see, it's attached to the rest of the body. So it frequently evolves more than just what my title suggests.
Wonderful. Okay, Talia, who are you?
Okay, I'm going to try this. I am a physician scientist or a medical doctor with a PhD or an MD PhD. And my specialty is infectious diseases. I do research on HIV and more recently COVID and see patients with the same problems.
Wonderful. Okay, Gretchen, who are you?
I'm a pharmacist.
Wow, fantastic. Okay, now for our audience who is dying to get to know you all a little bit better, what I'd like for you guys to do is just come back through and take a few more minutes to talk a little bit about describing the key highlights of your profession and what makes your profession unique. So again, Dr. Walker, as I can now address you. Dr. Walker, tell us a little bit about being an audiologist and what that makes. What makes that profession unique?
Absolutely. So in audiology, we specialize in hearing and balance disorders, communicative disorders, if you would. And we work on diagnosing people's hearing problems. And hearing problems can happen when a person is very young. They can happen from birth, or they can be acquired later in life due to noise exposure, i.e., AirPods going too loudly in your ear. If I can understand what the rap music or the other music is saying while we're on the bus or while I'm walking past you in the park, it's too loud and you're going to be seeing me a little bit quicker than you need to be, okay? But it's a very fulfilling role. I really enjoy putting hearing aids on someone who needs them for the first time and getting a huge reaction. The people normally will come into the clinic when they have hearing disorders, and they will kind of be a little bit more reserved, or sometimes people have gone away from society a little bit because it's harder for them to communicate and understand what people are saying in restaurants or in groups of people. But when I put the hearing aids on them, I see their eyes light up, a huge smile just broadens across their faces, and they're like, whoa, I hear you typing on the keyboard. I can hear, the birds chirping again. I can hear all kinds of things. Is that a fan that I hear? So I love the fulfillment that brings to helping people. No, this isn't a Miss America project or type of thing, but I really enjoy getting to help people through the knowledge and the skills that I've gained in school. And again, I just appreciate being on this panel with so many fantastic professionals.
Wonderful. Thank you, Dr. Walker. Ms. Gold, would you like to tell us a little bit about your profession and what makes it unique?
Yes, I would love to talk about it. So as a speech language pathologist, you can focus in specific types of settings in terms of where. You can work in the educational model, like a school, a public school system. You can work in the medical model, which would be a hospital or an outpatient clinic, or you can even work in a private practice and work for yourself. I also mentioned another setting, the judicial system, and you can even service the public, like working in jails, working for the government, so on and so forth. What makes it really unique is that you have to have a certain toolbox depending on which setting you work in. So I work in the schools and I work with kids ranging from kindergarten all the way to 21. And when I look at students and I assess them, because I'm bilingual, I actually assess children who have other languages as a background, like Spanish, Hindi, and Urdu, which are some of the languages I know. But the 5 areas we look at are expressive, receptive. We also look at pragmatics. We look at fluency and articulation. Those are the fabulous 5 areas I look at. If you are in a medical setting or even a private practice, you will probably see anywhere from birth to adult clients or patients, as they're called. And you would primarily look at feeding and swallowing, also known as dysphagia, and speech and language are, of course, other areas, and cognition, mainly in adults and a geriatric type population. So it's very specific, but it's also very unique in the sense that we are multidisciplinary and take a very collaborative and consultative approach. We work with many different professionals, including some on our panel here today. And I would say one of my closest friends are people like audiologists, such as Dr. Walker. And we work with them in the medical, private practice, and even educational types of model settings. So it's very unique because each setting has its own sort of niche and expertise. I have been fortunate enough to work in all different types of settings, including home health, including a skilled nursing facility, and including a private practice. But my main focus has always been the educational model, which is with students who are high need and life skills. So I hope I've given you somewhat of a glimpse into how unique we are. Thank you.
Wonderful, thank you. Dr. Lowell, all the way at the other end of the body, tell us what's unique about your profession.
Well, hello again. People come to see us every day with complaints related to not being able to run, work, bike, walk, or at the very least, stand. Frequently, the pathology associated with that complaint is something relatively treatable with conservative measures such as inserts, injections, padding, elective, or even reconstructive surgery. However, often it is related to a more serious condition like trauma or infection. I have this scarf. It was made by an elderly veteran patient of mine many years ago, and it very simply says, "I fix feet." It's in my office reminding me of that veteran. After months of wounds and illness, debility, and surgery, he finally walked again and thanked me for fixing him. His life was saved by sacrificing half his foot. When you get right down to it, that's what I do. I'm a foot and ankle specialist. It seems simple, and it can be. It seems straightforward, and sometimes it is. But it's often more complex and challenging, and unfortunately, despite our best efforts, there are times where we just can't save them. We can't fix them. That's when we have the most difficult conversations of our career, and we're talking to patients about the need for losing a limb. So when I say I'm a podiatrist, I'm very proud of what my profession allows me to do. When I'm successful in fixing someone's foot or ankle, it's a good day. Patients are very appreciative of the simple things like being able to stand, being able to walk, play with their kids or their grandkids. Athletes return to running, return to dancing, and return to other sports because of us. So if your goals are to help people and make a difference in someone's life, podiatry might be the field for you.
Thank you, wonderful. And Dr. Swartz, tell us a little bit about your journey to being a physician scientist.
Yeah, thank you. And I'm so inspired by all of our panelists. I got into the idea of physician science when I thought that I wanted to go into medicine and thought that doing research in a laboratory would help me learn about medicine. And it turns out that I was wrong because they're two totally different worlds. But what I figured out was that I really loved science. I really love the idea of doing experiments in the laboratory and to be able to learn new things about nature. And the idea that I could apply that to improving human health was just mind-blowing. And when I was in the laboratory, I met two MD PhD students who were telling me about their career goals to be able to combine both their ability to innovate in the laboratory and to be able to improve on patient care. And that was just fascinating for me. So I was very lucky to have known about that at an early age, which is why I think it's important that we talk about it here. The career path is really long, and so because it is a dual degree, it's about 4 years of each degree, so it's 8 years total, and then there's some more training after that. So once you finish your MD PhD, you do a residency and fellowship and more. So it's a really long time, but the good news is that if you love it, you're not working and you're not miserable because you're in pursuit of this journey that sort of continues. And even though I formally finish my training, I feel like I'm always continuously learning new things. And that's one of the fun things about being in an academic environment where there are students coming in, going through our training program all the time and learning and teaching us new things all the time. And so every day, you never know what you're going to find. It's exciting and stimulating and fun and interesting and sometimes really painful and scary, particularly during the pandemic when we found that the traditional therapies that we're usually able to offer patients were just not working. And it was at that time that it became so evident that we need science to be able to innovate in developing vaccines and developing therapies and figuring out how to treat these patients. And so for me, it exemplified the reason that I went into this is that we did not know how to encounter this pandemic and needed to be able to innovate really quickly. And it was the physician scientists that were at the forefront doing that. It makes me really proud to be part of this profession. And still, our laboratory, which had studied exclusively HIV up until last spring, needed to pivot. And it turned out that the research that we had been studying, understanding the mechanisms of how HIV can cause inflammation in cells and cause bad outcomes in patients, turned out that many of the very similar mechanisms were happening in COVID in the people who were really sick, the ones on the ventilators who were developing this respiratory failure. And so we quickly transitioned to studying the similar pathways that we have been looking at in HIV in COVID, and have been since that time understanding some novel potential therapeutic targets that might be important in helping us to understand this and be able to treat it. And so now, you know, the work that we're doing in the laboratory has the potential to be translated back to patient care. And so one of the things that is important is the idea of collaborating with different stakeholders to be able to share expertise and think about complex problems from different perspectives. And I've been very lucky to be able to do that with a bunch of phenomenal colleagues so that we can work in teams and be able to constantly be thinking about new needs and innovating ways that we can improve health outcomes for patients.
Well, wonderful. And thank you for what I am sure are thousands of hours over the last year trying to get us out of this pandemic. So fantastic. Dr. Garofoli, tell us what makes your profession unique as a pharmacist.
I will. So pharmacists are the medication experts. We learn how all medications work in the body, and we're able to make recommendations to other healthcare practitioners to best meet the needs of our patients. So pharmacists can really work in a variety of settings. So I work in academia. I'm a professor at a university, and I also practice in the community pharmacy setting. So pharmacists can work strictly in the community pharmacy setting, like I get to spend some of my time in. They can work in the hospital pharmacy setting. They can also round with physicians and other practitioners on teams in the hospital. They can also work in an office setting. So pharmacists really can work pretty much anywhere. So pharmacists are also able to provide immunizations, that preventative care that I talked about in my intro. And we give lots of immunizations to help prevent diseases. So I've been busy the last 6 months doing COVID-19 vaccinations. I counted them up earlier, and I've done 50 to 60 individual clinics over the past 6 months. So it's been a very busy time. When I'm not doing COVID vaccines in the fall, I do flu vaccines and other preventative vaccines throughout the year in my practice. I also do diabetes education. I review patients' medications and make recommendations to other providers. And we help patients figure out what's going on. So if you're a problem solver, pharmacy is a great profession for you. So for example, if you have a patient that comes into your pharmacy and they can't remember to take their medication twice a day, you can look at the alternative agents that are available and make that recommendation to help the patient get on track and help get their condition under control. Other things that you can do as a pharmacist would be really helping patients to understand how to utilize their medications. So if they're on an inhaler, teaching them the proper techniques so that they can have their asthma or their COPD under control. If they have diabetes and are on an insulin, they need to know how to inject that, and pharmacists are trained in the injection techniques so that we can teach our patients how to get the best benefit and utilization out of their medications. So that's a little bit about what I do. And like I said, pharmacists practice in multiple different settings. So each of our positions might look a little bit different, but we all have the ultimate goal of managing medications and making sure that the patients get the best benefit that they can get out of their medication regimen.
Wonderful. Thank you. Okay, so I have 2 follow-up questions. These questions are open to any panelist who'd like to respond. Our first question is, what types of extracurricular activities should students who are interested in your career pursue to help them understand your profession?
So
Dr. Lowell?
I'll go first. Any experiences in education and training for the medical field will help candidates determine if medicine, specifically being a podiatrist, is meant for them. The field of podiatry is both medicine and surgery based, so a person interested in both would benefit on hands-on workshops dedicated to surgery or suturing or traumas. You can connect with an advisor who can find coordinators at any of the podiatry colleges where they have open houses that they can attend. And they'll also get you in contact with a current student or resident or program director. If interested people go to the aacpm.org website, there is a Connect a Mentor network. And I have students contact me quite often, and they come and they visit, they spend the day, they go on rounds with us, they see what our clinic is like. I get them talking to students and residents. We go in the OR, and in one fell swoop, they get a great idea of what it means to be a podiatrist.
Oh, those are exciting opportunities. Thank you for sharing those. Is anybody else? Yes, Pooja, yes.
So as far as volunteer opportunities, I would say there's a couple different things you can do. First, I would think about shadowing an SLP in a variety of different settings. So if you can shadow an SLP in a public type school setting, if you can shadow an SLP in a medical type setting, both hospital and skilled nursing, to see if you are cut out or feel comfortable in working with specifically the geriatric population in the skilled nursing area. I would also encourage people to go to asha.org, which is our website, which has so much information and is rich with experiences of students, practitioners that are early in their career, seasoned practitioners, and a wealth of knowledge to explore our field, and also different universities that offer our type of training. And also volunteer is a big thing on my list. I think anybody who is looking to volunteer by going into a hospital or a skilled nursing facility or even an educational setting can really get a more hands-on experience on what it's like to work in those kinds of settings, which most of us are employed in. Thank you.
Also great suggestions. All right, we have a second question that we'll tackle next. It's been a tough year in healthcare from A to Z. If you had a piece of advice to give to someone who was considering a healthcare career, specifically your profession, what would that piece of advice be?
I'm ready. So,
Dr. Lowell, we'll do you.
hi there again. As you can see by this beautiful panel, being a doctor is such an ambiguous description. It covers all the professions here: internists, dentists, surgeons, from general and transplant to vascular and cardiology. There are endocrinologists, dermatologists, urologists, pathologists, anesthesiologists, and so many more subspecialties that can be considered. My advice is to try and think and figure out what kind of doctor you want to be 10 years from now. What kind of work-life balance do you want? And I'm going to make a couple generalizations here. For instance, pathologists, mainly work with specimens in a lab. Cardiothoracic and vascular surgeons have extremely long days in the OR working on typically very sick patients. Dermatologists do a lot of procedures in an outpatient clinic setting. Transplant team surgeons and ER physicians have extremely long, unpredictable call days and nights. Some of these professions are more lucrative than others. The payoff, again, is the work-life balance. Podiatry has provided me with a lucrative career and with a great balance of home life. It's full of very rewarding OR and clinic time taking care of patients, and allows me to work with my hands, continues to teach me, and at the same time gives me ample opportunity to do research and get involved in national podiatry organizations and wonderful opportunities like this. So again, my advice is try to think about what you want to be in the future, what kind of doctor, what kind of life you want to have when you're done with your education. And you'll be able to figure it out from our profession to any of the other professions on this panel.
Excellent advice. Dr. Garofoli, did you also have a piece of advice?
Yeah, so I would say, like some of the other panelists said, shadowing is very important. Whenever I was in high school, I got to shadow multiple different healthcare practitioners, which was very fortunate of me. My parents are both pharmacists, so I kind of knew what I was going into at a young age, but I did my due justice and I looked at all different kinds of healthcare fields before I decided what field I really wanted to end up in. So I would really get out there and shadow, and we have a small sampling on the panel today. We don't have anybody that's in physical therapy, occupational therapy. A lot of those other folks are very valuable members of the healthcare team as well. So getting out there, contacting local places that do these types of things, and you can see about shadowing them. So I think that that is a very valuable experience, is having the shadowing experiences and also leadership experience. I think that for multiple positions in our fields, no matter what type of healthcare you get into, when they look at your application, you really need to have leadership experiences, because all of us here, you've heard from some amazing panelists that are doing wonderful things, and everyone here is a leader. And so thinking about setting yourself apart and getting leadership experiences early on in your career.
Wonderful thoughts. Yes, Dr. Walker.
Amazing advice is coming at us. All these golden nuggets are fantastic. I would love to link up with you all to say that when I was coming along, we used the Occupational Outlook Handbook, I think that's what it was called, to help us kind of understand what areas we might be interested in, and then that could kind of lead us down a certain path. Another area of advice that I would also recommend, in addition to everything everybody else has said, would be to take a strengths-based assessment like Clifton Strengths, or I think you have the Myers-Briggs, to help you kind of understand what your strengths are in and I don't know, maybe even what your leadership style is in. I know we've talked a little bit about, getting involved in some leadership activities. We are definitely all leaders. I can tell you that it's a wonderful thing to be at the forefront or the cutting edge of the research that's going on or the clinical trials that are going on for understanding and getting ahead of the different disorders or the different things that may come our ways. That helps us be experts. So, and finally, I want to reiterate that it's great to talk with a counselor about the different things that you are interested in. Talk with them about your strengths, talk with them about your weaknesses. Be honest and consider those things that are within your wheelhouse and go with it. Go with the flow. Get out there, try new things. Don't be afraid to step out into some deeper waters. And if you happen to fall down and scrape your knee, just get up, brush yourself off, put a Band-Aid on it, and try something else. It's totally okay. So.
Wonderful, wonderful pieces of advice. Thank you. Okay, and with that, I do think that we are out of time today. So I want to say thank you so much for playing Guess Who with us today and extend my final thanks to our panelists. I just want to know, did we manage to stump anybody? I am really curious. You can learn a lot about the various health occupations that we learned about today by visiting us at our website, which is explorehealthcareers.org/HPW. If you have any follow-up questions for our panelists, you can reach out to Health Professions Week at our Gmail account, and we'll connect you to these or other staff who can help you learn more about careers in the health professions. I want to encourage you to keep exploring careers. We mentioned that there are lots of other occupations on our YouTube channel. You can actually watch the Guess Who panel from last year, which had a physician assistant and a physical therapist on it. So specifically those two occupations, but there's so many occupations for you to explore. So I encourage you to continue to keep exploring. And we have lots of resources for you at Health Professions Week. You can learn more and register at our event by visiting our website, or you can just grab the QR code with your smartphone, open up your camera and point it at it, and it'll direct you right to our website to learn more. Thank you, everyone. I had a great time. I hope you had a great time, and we'll talk to you all soon.